IVF does not raise breast cancer risk, study shows. Women undergoing in vitro fertilization have long worried that the procedure could raise their risk for breast cancer. After all, the treatment requires temporarily increasing levels of certain sex hormones to 5 or 10 times the normal. Two of those hormones, estrogen and progesterone, can affect the course of certain kinds of breast cancer. A series of studies over the past decade suggested that these former patients may have little to worry about. Experts remained cautious, however, because women who had undergone IVF in the 1980s had not yet reached menopause by the time of the research. But the largest, most comprehensive study to date, published Tuesday, provides further reassurance. It finds no increased risk among women who have undergone IVF. The main takeaway is there's no evidence of an increased subsequent risk of breast cancer, at least in the first couple decades, said Dr. Sandra Spies, an oncologist at the Huntsman Cancer Institute at the University of Utah, who was not involved in the new study. The issue has nagged at specialists in reproductive medicine for some time. In 2008, a retrospective analysis of medical records, which the authors called preliminary, found a potential increase in breast cancer among IVF patients older than 40. Another small study of participants at a treatment center in Israel reported an increased risk of breast cancer among women who start IVF after 30. Maddeningly, later findings went the other way, seeming to suggest the danger, if there was one, may be greater for younger women.